Good morning, guys. I hope we're all sparkly. Today is my admin day, so I'm catching up on emails and tasks. But I spend the first part of every day doing diagnostic calls. So if you order your blood test through the Men's Health Clinic, you will get a 10-minute conversation with me as into whether your testosterone levels are low and what you can do to hopefully avoid testosterone and what you might do to improve your overall health, because the TRT Complete Plus blood test is a very comprehensive test that looks at all the necessary markers to not only diagnose testosterone deficiency, or not as it might be, but also look at other things that are important for men's health and general health. So yeah, the first part of my day is having a chat to you guys, and I spend most of my time actually advising you why you might not potentially need testosterone replacement therapy. Shock horror. Testosterone doctor doesn't want you on testosterone replacement therapy unless you clinically need it. Now that needs to be a considered conversation with somebody that's going to act in your best interests, who understands the condition and wants to act in your best interest by not subscribing you to a medication that should be considered a lifelong therapy, but you can come off of it, but it should be considered a lifelong therapy because you shouldn't go on it unless you clinically need it. Now, it can be utterly transformatory if you need it. If you don't need it, all we're doing is normalizing physiology. And what's that? That's how your body functions. So if you can do that naturally through addressing all those things like stress, sleep, nutrition, exercise, and mindset, do it. Because if you go on testosterone replacement therapy and you're not doing those things, you're not going to reap the benefits. Now, as we've said numerous times before, earn your reward through determined effort. You can only do that really if you are the best version of yourself. So how do you do that? Well, you look after your health by addressing the things that we've just spoken about. Now, isn't it scary that we have to have this conversation, that we apply this level of flippancy to our own health? We don't do the right things. Now, why don't we do the right things? It's because we live in this artificial, perverse world, not surviving. All other animals are concentrating on surviving, finding shelter, finding food, hopefully having a bit of nookie to procreate and pass on the DNA. But what are we in this weird playground where we have to earn money through doing things that are not necessary for our survival to allow us to buy things to allow us to survive? What? It is utterly perverse. So it's a really bizarre conversation that I have to have with these guys. Looking after your stress, looking after your sleep, looking after your nutrition, blah, 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 blah. Ad nauseum, because we're distracted, we're overstimulated, oversaturated with utter nonsense. We should be living more according to our physiology to allow us to improve our psychology, to improve our emotions, not focusing on our feelings. Honestly. So yeah, what we're going to talk about today is the perfect patient. Now, the perfect patient's obviously got all of those things in check. So you should be a lean, mean fighting machine, but just have low testosterone. Well, that's obviously unrealistic. So if you're morbidly obese, I should be saying lose 20 kilos and then come and see if you've got low testosterone. But your physiology is going to fight against you, as we've spoken about numerous times in previous videos. If you go on a severe caloric deficit, a stress state, that's going to raise your SHBG with low testosterone to lower free testosterone to make you feel rubbish, to make you less motivated. It's going to cause thyroid to dysregulate, so you're not going to be able to lose weight despite your best efforts, despite people saying, yes, you must lose weight on a caloric deficit. Yeah, you only lose weight through a caloric deficit. But if you've got clinically low testosterone, as in pathologically low testosterone, your physiology is fighting against you. And you can't outthink your physiology, because you can't outthink your physiology, because that's how your body functions. So yeah, when you have a conversation with your TRT doctor, it's going to be considered. So if you are a junkie monkey and you are being reasonable in your expectations, you can obviously consider testosterone replacement therapy. Testosterone replacement therapy will help you lose weight. So can I use it as a weight loss drug? No. Should you use it as a weight loss drug? You should use it to normalize physiology. That's literally it. Should you use it for performance enhancement? Now, obviously, testosterone is a performance enhancement drug in excess. At normal levels, it's just normal physiology, how your body functions. And all these guys chasing high numbers. Oh, I don't want a free T of 0.5 to 0.85 because I think a free T of 0.12 is going to give me superhuman powers to allow me to get gains in the gym. It's not. Absolutely not. Now, if you want to get massive, you're going to have to do the naughty things. And then you're going to dysregulate lots of things. Not only are you going to render yourself hypergonadal and come and see me for testosterone for the rest of your life, you're going to cause added stress on your musculoskeletal system that you are presumably trying to improve to be the best version of yourself because you want big muscles. But you're going to place that stress on the joints. And that stress on the joints will wear the joints down. And then you're going to be in trouble. So you're going to use those muscles for what? Yeah, nothing. Your cardiovascular system is to be placed under extreme stress. You're going to get a large heart. Your blood pressure is going to go up. If you run 5K and your physiology is more than it should be, you are a monster compared to what you should be able to achieve genetically. You are placing additional stress on your cardiovascular system. And I quite like my heart. I want that to work perfectly for as long as possible because it's now about form and longevity. Your brain becomes dysregulated with high testosterone levels, with high dopamine. That sounds great, high dopamine. Everything downregulates because it has to, because nothing likes to be high for long, because the body survives on the concept of what? Yeah, you guessed it, balance, yin-yang, baby. So the contrasting process, cortisol, and the counterbalance to that, testosterone, cortisol, testosterone. Anything in excess is bad for you. And as humans, we're pre-programmed to seek reward. But because we live in this weird world, we seek reward from the wrong places. So yeah, let's get back to this perfect patient who's already looking at their stress levels, getting good sleep, has a healthy diet, is exercising regularly, and has got the right mindset. Earn your reward. Lots of patients walk into the clinic and say, I've watched all your videos. And I say, poor you. Earn your reward, eyebrow all sparkly. But the message has to get out there amongst all of the other nonsense that's there. A patient said to me the other day, he was slightly shocked by the amount of profanity that comes out of my mouth. I do that to show you that I'm a normal person, because there's been this big divide between doctor and patient, and we've had this paternalistic relationship, and we don't need that now. Now you've got access to all the information that you need, but you need somebody to refine it and give you the necessary support so that you can move forwards. So you need to take personal responsibility. You need that autonomy, but you do need that support, because there's a minefield of information out there, and lots of it's garbage. Some of it is good. So hopefully if you have watched the videos, you come in with this positive mindset going, give me the tools so that I can help myself. And these are the best patients. These are the best patients. They want to improve themselves. They don't want me to improve them. They want to take personal responsibility. So yeah, the perfect patient is motivated. And with low testosterone, you lack motivation, but you must find that will, that drive, that determination to be better. And as human beings, we always take our foot off the gas when everything's amazing. Isn't that a perverse part of humanity? We get to where we want to get to because that's the goal, and we should always be striving to achieve goals, and then go, well, what next? Because there is no destination. And we talk about life as this journey of continued effort, determined effort to achieve the reward. And the reward being a destination is an illusion. We need to understand that. Now, testosterone replacement therapy is sometimes the necessary catalyst for change. But testosterone is just the foundation to allow you to put determined effort to be the best version of yourself. And as Buddha says, as we wake up every day, it's a new opportunity to be the best version of ourselves. I think I mullered that quote. But anyway, I hope you get what I'm talking about. What else is there to say? Watch Dexter's ears prick up. Earn your reward. Dex, you've let me down. Ta-da, guys.